All right, welcome back to my YouTube channel. So you can also check me out on Facebook, Instagram, or Twitter. And check the description box below for information on how to get those links. And also push on the red button to subscribe to my channel. This week we're going to talk about postmenopausal bleeding and what to do if you're bleeding over the age of 60. Now certainly some women will go through menopause much sooner, so it's really bleeding anytime after menopause. I've had patients come and tell me, I just had one drop of blood, just one little spot. And that's important. So definitely I want you to let your primary care doctor or your gynecologist know, because any bleeding after menopause is very important. Now when you go to the office, they're going to want to see you, and what they're looking for is first they're going to do an exam. So they're going to look at the vagina, look at the cervix, and make sure the bleeding is coming from the uterus, because you can have bleeding from other locations. You can have bleeding from the bladder. You can have bleeding from the rectum. I've had patients with hemorrhoids that have bleeding, patients that have bladder infections. So those are some of the most common things I see. But definitely I want you to make sure you see your doctor right away. That's the most important tip. Now when you go to the doctor, what they're going to look for is a couple of things. They're going to get an ultrasound. So one of the things we do for the ultrasound is we want to look at the anatomy of the uterus, or look at the structure. We want to make sure there's no tumors or masses in the uterus. We want to make sure the fallopian tubes are normal and the ovaries are normal. Now this model has a lot of different abnormalities. And just for illustration, one is the fibroid. Those are very common. I see them all the time, and they can cause bleeding. Another thing is the polyp, and that's described here, and they're very common. Often they're benign, but they can have cancer in them. So when you have bleeding after menopause, there's one thing we're really looking for. We want to make sure you don't have, and that's endometrial cancer. Endometrial cancer is the fourth most common cause of cancer in women and the eighth leading cause of death in women. So we definitely want to make sure that we investigate and make sure you don't have an endometrial cancer. And when they get the ultrasound results back, whether they do it in the office or send you to a radiology center that have the ultrasound, what we're looking for mainly, besides the structure of the uterus, tubes, and ovaries, is the lining of the endometrium. Now typically we want that lining to be less than 5 millimeters. If it's more than that, we call it endometrial thickening or abnormal endometrial stripe. Those are some of the terms you may hear or you may see in your report. Now what they're looking for is, if that lining is too thick, then we need to investigate a little bit more. We usually investigate with an endometrial biopsy. We do that. It's a very simple office procedure, and we do it with the instrument called a pipelle, and we just insert it into the uterus and get a nice biopsy. It's very easy to do. Doesn't cause a lot of pain. It may cause a little bit of cramping, but most women tolerate it in the office well. We also want to make sure you've had your pap test. If you haven't had a pap test, they'll do that also during your office visit. When they get the endometrial biopsy results back, they're looking for the health of the uterus to make sure that there's no precancer changes called hyperplasia, and also to make sure there's no cancer. Now some women, when they have an endometrial biopsy or get set up for the procedure, they may have some scarring or something called stenosis. Now stenosis is when this lining is very scarred, either from prior surgery, but it makes it hard to do the office biopsy, and those women may have to have a D&C, and that's a dilation and curettage, very common procedure. It's commonly done after a miscarriage, and it's done in the operating room. It's an outpatient procedure, very easy, but I want you to know that sometimes the D&C is necessary. Well, so there you have it. We've talked about kind of the anatomy of the uterus, what we're looking for if you're having bleeding, and kind of one of the things that the doctor is worried about, and that's cancer. So we want to make sure that if you have even just a little drop of blood, you go see your doctor right away. So we want to make sure you have a very healthy and happy uterus. All right, so don't forget to follow me on Instagram, Facebook, and Twitter, and I'll see you next week. All righty, talk to you later. Bye, guys.